Yeah.
Yeah.
Yeah. I don't know. Yes, yes, yeah, it was just because of something else. Share. Everybody else was encouraged to have an in-person.
Yeah, from what people were calling me, and they would, people would want to be online, but no one, I gave them my email, no one asked for it.
But I knew the code.
I guess they didn't.
All right, everybody, we're gonna get started with the Healthcare Advisory Committee meeting. Today is October 28th, 2025. So I would like to call to order this meeting of the Healthcare Advisory Committee meeting. I could do a roll call, but I think what we'll do, just because there's so many people here today, is we'll just go around the table with the members of the committee. If you can just please introduce yourself, your role on the HAC and which organization you're with. So my name is Lacey Simpson. I'm the acting city manager for the city of Ketchikan, and currently I'm serving as chair for the Healthcare Advisory Committee meeting.
Amanda Robinson. I'm the Assistant Public Works Director for the City of Ketchikan. I am a member of the Healthcare Advisory Committee.
My name is Judy Zingy. I'm the Vice Mayor for the City of Ketchikan, and I'm a member of the committee as well.
You're not. I'm not. Checking. You're always very official in this space. Tim Horton, pediatrics and, so. Scott Smith, I'm the Support Services Director, with Peace Health.
Eric Clutch, Chief Administrative Officer at Peace Health. Great, thank you guys. All right, so those 6 individuals serve as the committee members for the Healthcare Advisory Committee. We'll move on to item number 3, which is communications, which I don't believe we have any items, which brings us on to item number 4, which is persons to be heard. We have a number of folks who signed up tonight. There may be more in the room. I'm going to ask, because there is a scheduled Peace Health Community Health Board town hall right after this meeting at 6 o'clock, that those of you in the audience that are wishing to address the HAC to please keep your comments succinct and brief so we can hopefully get through as many people as possible before we move on to the main agenda and the business of the Healthcare Advisory Committee. So Kim, do you want to?
The first person that has signed up is Mark Weaver.
Thank you. First of all, to save time, I'd like to turn my back on no one. And if it's okay, speak from here. I'm Dr. Mark Weaver. Mark Weaver now. I consider myself still a strong advocate for patient safety and caregiver safety, and that's for the perspective of which you'll be hearing from me. I have prepared comments that I need to stick to for various reasons, but the concern has been expressed in the community. You've seen the new Facebook page, multiple concerns from multiple patients, some concerns from caregivers, both past and present. In my diagnosis as a surgeon, Peace Health suffers from a malignancy, a terrible malignancy, a malignancy of silence. This is a silence of the frontline caregivers, not the care managers, not the care administrators, although they play an important role in our healthcare community. The caregivers. They've been silenced, including Pam Stanley. Her letter really brought me to the need to speak to this community and this committee. And thank you for your time. It's just an awesome commitment. Nurses, certified nursing assistants, patient access representatives, housekeepers, and the building engineers were all taught and encouraged to speak out, speak up. Peace Health has named the system that they provided for employees for reporting incidents and errors as the Safe to Share. But is it? I have heard many who have said no. And yet they are all morally, ethically, and in some cases, contractually obligated to bring up quality and safety concerns. Concerns particularly within their respective departments. The picture that emerges is a malignancy. It's a malignancy of retaliation, which induces silence. Ask your friends and family who work for Peace Health. In private, of course, you don't speak out in public on this, right? And many will tell you they have shared with us and many others That silence is spread throughout the institution and it's deeply integrated into the leadership DNA. They survive by adapting the mantra of keep your head down, keep your mouth shut, and keep your job. That's suppresses very important safety reporting. Peace Health leadership structure can changes from time to time, yet always falls back to a command and control framework that was used 30 years ago. That's not the way it is now elsewhere, not the way it should be here. This communicate and collaborate culture helps foster a stability in the system. It helps prevent repetitive complications, injuries, and unfortunately, it even prevents death sometimes. Moral injury, when these nurses and caregivers and associates of mine are silenced, it creates moral injury. It's not burnout. We're not burnout. We came to this job as a calling. And when we come to work, or when I came to work at Peace Health, every day, you had to have caring in your heart. When you're morally injured, outsiders will call it burnout, but it's moral injury. Without respect for robust and open-minded discussion, which can often be difficult and disruptive, employees leave, doctors leave. They can go elsewhere in practice. We have high rate of turnover here, excessive. Nurses leave or departed for speaking up for patient safety concerns. Other employees, like our CNAs, the heart of our hospital, they're the ones that are there for you. It's easier for them to depart. They can get a job that may pay pretty close to what they were making, and they'll thrive in a new environment that's less toxic and hostile. Healthcare is tough. Respect what you do. As an administrator, it's tough. We have several administrators that are here and on board with us. We need administrators, but we need administrators that will function under a different type of culture, one that involves communication and collaboration, particularly with the community. That's all we've got. This is the only hospital we'll have, whether it's under Peace Health management or not. We're in this together. We live on an island. You know, we'll hear stories tonight. You've seen them on the Facebook page if you're following that. There'll be folks talking about the clinical care. All right. There are unheard voices. People want to be heard. They should be heard. They must be heard. And yet they are not heard. Their clinical jobs a thankless task, and it's often critiqued. It's calling. They go into it because it's calling. And when they're critiqued, it hurts me. It hurts me deeply because there's only so much care that one person can give before they are morally injured and they're not able to come into work in a happy place. None of us are perfect, and miscommunications and actions or inactions can sometimes do result in harm, serious harm. But imagine coming in for that extra shift or that night shift that you didn't have to be scheduled for, but maybe they're short. Realizing that if you speak up or speak out for patient rights or safety, you may find a target placed on your back. Speaking out may target you. I've seen it happen. I know it personally. This may lead to a performance improvement plan, maybe if you're lucky, or it may lead to termination or departure, which has happened. This could be any one of our caregivers' story. It shouldn't be anybody's, but it has been, and it will continue to be unless we influence the lease, unless we influence the community. Each of us are patients, past, present, and future. We want better, we should demand better, and we should structure the lease to help us find accountability for Peace Health. And again, it takes communication, it takes collaboration. That does not exist at Peace Health Ketchikan, in my opinion. No, thank you for your time.
Thank you. Pamela Stanley?
I took the liberty of printing some of these, so we'll have them as follow-up after the meeting, to keep it brief. And so
with everybody's time. First and foremost, I just want to thank everybody for coming tonight, making your presence, making your voice heard. It's very important for the community. This particular meeting is about the lease and how Peace Health either is or is not upholding the lease in the community. So under sections 1F, 5, 6, and 7 of the hospital lease, I feel like the Ketchikan community is out of compliance. Specifically, to operate in support of the community within the Ketchikan service area to maintain compliance with all the laws, including CMS and Medicare and Medicaid and Joint Commission, and last, the Department of Healthcare Regulations. Long-term care complaint survey. I see that's on the agenda later, but I just want to let you know that the daily rate for a private citizen in long-term care is $2,000 a day. That's $60,000 a month, right? That's a lot of money. What do our residents get for that? Abuse, neglect, they get their privileges taken from them. The licensed nursing home administrator came in and took residents' checkbooks. They refused to let them use the van, refused to take them to the parade, refused to do all kinds of things for them. Why? Why? Greed. Greed. Greed is the seed. So instead of supporting them, I was told by our chief administrative officer on 4/14, I got an email saying, cut your staff. When you look at that report I put on the table, it says the chief nursing officer said that they had been short-staffed since December of 24. It's not in alignment. Where's the truth in that? Either we were short-staffed or we weren't short-staffed. If we were short-staffed, why was I asked to cut staff? The result of that was I was targeted. I received an egregious, that's Sarah's word, egregious performance improvement plan, and I was terminated. That's the Peace Health MO. They target, they PIP, they term. If you have a voice, if you speak up, you will be fired. So if you're not part of the union and you work with Peace Health, you better have another job opportunity in your back pocket. So I put the report on the table. It's a public report. Everybody can read it. Everybody can see it. There's a link on the bottom that says exactly how you can access it. I have plenty of extra copies. I'm free to supply that. So leadership. What was leadership's role in this, right? When it was under my directorship as the director of long-term care, it was a 5-star facility, and we were recipients of the Bronze Quality Award nationally, right? I left July 3rd, and it went to hell in a handbasket. They brought in someone to replace me. She was a licensed nursing home administrator. They must have called and said, we got this, we're running this, we don't want your help, we need your license. We need a license on file. Send us someone dusty that doesn't know what they're doing, because she obviously had no clue what the regulations were. She violated resident rights. She abused residents, and all in the presence of our chief administrative officer and our CNO. Is that what they're paying for? Is that what the city in Ketchikan wants? I'm asking you, is that what they deserve? I don't think so. If I wasn't the kind of person that I was, I would have bowed down to them and I said, yes, I'll decrease my staff. Yes, I'll do whatever you want me to do because I want to keep my job, right? That's what they want. They want you to fall in line. They want you to fall in sync. That's the Peace Health way. If you speak up, they push you out. I won't do that. I have a good mind and it's to be used. I'm not going to be anybody's pup. That's what they want. So I have some things that I feel like should be addressed. And I'm hoping that you as the community and the citizens will support this. So demands for accountability. I feel like that the public acknowledgement from Peace Health leadership of their direct responsibility the long-term care complaint survey. They'll try to blame it on me. They'll try to blame it on a licensed nursing home administrator that they hired independently with no feedback from long-term care, right? They're looking for a scapegoat. The responsibility lies in this room. Don't doubt that. A formal apology needs to be made to the long-term care residents, their staff, the family members, and to the community. Disciplinary actions against executives who violated CMS standards and resident rights for personal and corporate gain. Sarah Cook, Den Moyes, Kendall Sala, all need to have disciplinary action. They need to be transparent. They need to be reported to the Healthcare Advisory Committee, and they need to be shared with the community so that public trust can be re-implemented. Community Health Board, right? Our Community Health Board is just an advisory board. They only get what Peace Health chooses for them to see. So if they're our advisory board and they're supposed to be making decisions, and that's what the property plan says for long-term care, they said the Community Health Board is the one that makes those decisions. I was told by Sarah Cook, I-2820, in the presence of Jen Moyes, that the Community Health Board only receives super high-level information. They're not to get any specifics or any details. How are they supposed to make decisions and govern for big advice or suggestions if they're filtered? They're worthless. It's not their fault. It's Peace Health's fault. Number 5, a formal request of the city of Ketchikan to request a proposal for a new healthcare system for Ketchikan. I suggest that you look at a management system that is similar to Juneau or Fairbanks, where the board that makes decisions is chosen by the city council. A board for the city, by the city. Peace Health is here for Peace Health. They're not here to serve the community. And lastly, the Community Health Board needs their emails that are posted. I went back and looked at several of the Community Health Board presentations. You know, I think Dr. Horton spoke to the fact that we're here, we want to listen, we want your concerns, please get them to us. Their email addresses are not listed. If they truly are concerned and they want to know, they want feedback, where are their emails not listed? Lastly, my closing statement. Ketchikan's hospital belongs to the community. It does not belong to Peace Health. Our elders were abused, they were silenced, they were ignored, and those that were speaking out were terminated and punished. That is not the mission, and it is not the values. That is corporate misconduct, hiding behind nonprofit language. The Community Health Board has a duty, not an option, to act and to act on behalf of our community and our residents and our patients. In a system where profit has taken precedence over people, the dedicated frontline staff of Ketchikan Center remains steadfast in delivering their compassionate, evidence-based care to the community, to their loved ones, and to support. It is not your nurses at the bedside. It is not your mid-level management that is the issue. It is upper leadership. And Peace Health will never have a good functioning facility if we continue with our current leadership model. And if we change our leadership model, we will still have the same nurses. We will still have the same middle management. They won't go anywhere. They're people in our community. They're here to stay. What we don't need is people that have been trained and influenced by Washington Peace Health. Lastly, I want to just say that there's a picture on the outside of the flyer, and I have some of these that I can send to people. My voice comes from one of my very favorite residents. I was with her up until the day she died. She said, take your voice forward, make your voice heard, stand up for the community and stand up for what's right. And I'm here to tell you, I'm gonna stand up, I'm gonna fight. I'm not gonna sit back and let people abuse residents for their own personal and corporate gain. Thank you.
Thank you.
Michael Fitzgerald.
So long-term care is kind of a hot topic. And you guys are gonna be discussing it later on. I look forward to hearing about it. I worked at Peace Health for 31 years. For the majority of that, I was a manager, long-term care. And so I know how difficult it can be to keep long-term care in compliance. I usually got 3 stars on our surveys. I don't know how Pam ever came up with getting 5 stars on her. She was better at it than I was. And yet they fired her for sticking up for what she would have done. You're gonna be told tonight, if Peace Health is true to their form, that this was all because of one bad apple. But I am convinced that it's a broken system. Broken system that doesn't know how to run the long-term care in the first place, and that uses long-term care as a cash cow. I remember back in the days when Ken Tonjes was in charge. And he told me, you know, Michael, long-term care is the little engine that could. Our census goes up, our census goes down in the hospital. The long-term care pays the bills. Your lease says that the city representatives are supposed to hear from these representatives and be satisfied that all complaints, concerns, and rules have been complied with. If you don't find something in here that shows that's not the case, then you're not asking the right questions. That's all I have to say.
Thank you.
I was given a letter that was written by Janalee Gage to be read. She's out of town. This is not from me, this is, and she's, so her name is Janalee Minich Gage. She speaks only on behalf of herself and not any other entity or the city council. The letter is written only because she could not be here in person. She writes this with disgust because she has no expectation that Peace Health will ever get its act together. It is understandably why I continue to hear from the community members who are in full support of ending Peace Health lease agreement. The community of Ketchikan should not consider continuing its partnership with a corporation such as Peace Health, which has created a hostile work environment for its employees. Imagine if they could freely speak tonight. I venture to guess that the house of cards would crumble. Peace Health loves to talk, but I have yet to see them walk the walk. The eagle speaks out both sides of its mouth, one side of their mouth, and they will talk about how they care about the community and local staff. And then will same tongue, they will fire and allow hostile work environment to exist. And they say they cannot get or keep staff. Please share with us how many local staff members, specifically doctors, nurses, and support staff, have left since Peace Health Corporation signed the lease. Next, explain the abrupt downsizing of staff, including social worker who assists patients with the paperwork to help them pay for the services received at Peace Health, and very vital and important CNA staff that assists patients and nurses every day. Explain why these cuts were made at the busiest time in Ketchikan. Explain how beneficial this was for our community. I would like to understand the reasoning behind eliminating these positions, but then creating more costly positions in administration. Those who don't work in the trenches, who see our community members as numbers and dollar signs, are in charge. And I expect them to blame everyone but themselves. On July 23rd of this year, I had the privilege of observing the type of staff that Peace Health hires from outside of Ketchikan. It was disgusting to say the least. Their behavior was beyond reprehensible, and yes, they are no longer working there, but I would guess that these kind of employees are throughout the establishment, considering the number of people who have contacted her. What really struck me was the head nurse phrase, "We are not nonprofit, we are a corporation." Imagine my surprise to discover that we no longer work within entities whose values and goals align with the community that you can. Who no longer has the care and quality of life of our residents as their primary objective. Their main objective is their bottom dollar. I understand that the ongoing federal budget cuts are making it increasingly challenging for medical facilities, and this will place an additional strain on patients. Unfortunately, the burden of care will fall mostly heavily on those who least can afford it. I contend budget cuts should primarily target the upper levels of management rather than negatively impact those who deliver direct patient care. It appears that individuals in senior leadership positions, whom I refer to as the High Castle, often remain insulated from the repercussions of these decisions. Instead of facing job insecurity, they tend to safeguard their positions while dismissing essential care providers, particularly our local staff. I would like to provide a note regarding the potential issue of a request for proposal to explore the option of engaging a different organization to oversee the care of our community. It's important to emphasize that those personnel currently involved in the direct service of our community, like the workforce at the shipyard, will be retained by the new entity. Assertions that all employees will face jobs less are unfounded, as any potential reductions in workforce would likely be limited to higher management. However, not everyone has that option, but everyone deserves to have care that is delivered with dignity and respect, and our local staff here in Ketchikan deserves to work in a hostile-free environment. I would say to do better, but it seems Peace Health can only go from bad to worse these days. Prove me wrong. What happened to our itemized billing? That sure disappeared fast. And that's all she has to say. Our next speaker, Beverly Crum.
I didn't come with a prepared speech. I just gonna ramble on from my heart, I think. I am a registered nurse. I'm retired. I worked at Peace Health for 43 years. When I started, it was Ketchikan General Hospital. And it was a, well, community hospital. The hospital would be out in the community doing different events, things. You knew who was in leadership within the hospital. They were on baseball teams, different things like that. It was just all part of the community. It was a great feeling. And yes, we were still part of the Peace Health Corporation, but somehow we were afar from that. We still followed regulations, but maybe not that degree that was wanted by Peace Health at Washington, Oregon, wherever the head office is these days. Anyway, so over the years, I just keep seeing that the hospital is no longer visible in the community. There's little ads, every once in a while, pictures of people that you don't know. It's probably in the Washington and Oregon newspapers saying about, we care about you, that sort of thing. Whereas Search, I've just recently seen on TV, they're advertising all the stuff they've done from the beginning of time. Very evoking, and they've got their own people in those videos. They also put ads in the paper, that sort of thing. Seems like maybe they care. My personal take is I really would not want to see Peace Health not be in this community. I feel that their values, their mission is solid. It was good. I was always very proud of it. I just feel it needs to be reviewed and lived up to. There needs to be transparency. I think it's terrible of all this stuff that's going on currently, that's out on Facebook. I don't do social media, but I've heard. and just hearing rumors out in the community. That's terrible for our healthcare system to be advertised, talked about, in that sort of way. It's embarrassing. All right, on that topic. Recently I heard from someone in the community that said we've changed, or Peace Health has changed their transfer and their consult policy, that no longer does our own local hospital make arrangements or whatever, that actually is called down to, I believe, Bellingham now, and they make arrangements. How do they know what's going on, weather-wise, all that sort of thing, or what's good? If I have a physician down south that's covering me for a certain disease, and I request to go to that hospital, am I gonna be able to go there? Or am I gonna be told by someone that I don't even know, telling me, no, you can't go there? Anyway, that's all I have to say. Thank you.
That's the end of the list, Leslie.
Okay.
I'm sorry. Is that the end of your list?
Right, we were gonna ask if anybody else had anything else. Could you state your name, please?
Angela Clark Blandoff. So I'm gonna come please to the front. So this. So. Okay. All right. One, wasn't sure I was gonna make it here. And I've been debating actually, all week, whether or not to come here. So y'all have to bear with me. This is a very actually hard one for me to be here. I'm thankful y'all are having this meeting. It's very, I feel, long time awaiting and important. First of all, I want to say thank you all for allowing me to speak. I do want to say for myself, I grew up in the bush, logging camps. That being said, my first interaction with Peace Health, I was 17 years old, and I came in as a patient in the emergency room. My first interaction with someone was Dr. Winnell Snow. The reason I'm going back to that, it was a very good, in a sense, experience myself. I'm now choosing to break the stigma on mental health illness. The reason I'm choosing to do that is on the 4th of July, 2025, my 30-year-old son that many people in this community know, his name is Jonathan Michael Patterson. He was huge in this whole community and working with Guardian Flight. He was huge in this community and filling up Alaska Airlines jets that you all, at one time or another, have flown. He tested the fuel and de-iced those planes that many of you, if it wasn't for him, you would never get off this island. He was very smart, intelligent, and respectful. He delivered many of your packages that come in on this island. Because for so many years, I hid my mental illness. He felt he couldn't speak out on his. Many people in this community are put down, and people have been videoing people that are on the streets here, and many of those people, they are someone's brother, someone's uncle, someone's sister. And the reason I'm bringing this up right now is many years ago, Peace Health, you all had amazing rocking support systems at Peace Health. You had amazing psychiatrists. Dr. Winnell Snow used to work for you all. And down the way there, she wasn't getting the support that she needed to serve her patients. So much later on down the road, she went into private practice and now still is. Now, Dr. Smith, she was my younger child that's adopted out here. She is my baby out here's pediatrician. She worked from his birth until much later. And she too did not feel like she was supportive. She was asked to work numerous overtime hours and yet not compensated and completely burned out. So when she moved over to her employment at KIC, I moved my child specifically over there. Dr. Zink worked as an OBGYN as Peace Health. He was mine. Very Rockham, amazing, very kind, sweet-hearted person. Again, totally felt not supportive, burned out, and he too went over to KIC and now is in private practice. I'm trying to think specifically of a few other people. Susan Weisner used to work for Peace Health many, many years ago. She signed on as a psychiatrist. She did not only medication management, but also psychiatry. She signed on with the understanding that she would be able to do support groups for people with mental health or depression and things like that. That never came to fruition. And with the support groups that she had planned on doing, she also had asked me when she started the support groups if I would be willing to help participate in that. That never came about. She had planned actually to permanently make Ketchikan her home base, but because that never came about, she felt like this wasn't the place for her. I have seen numerous physicians, great providers here, and because of lack of support, being overworked, and I've also seen and talked to numerous itinerants that they too have been overworked, and also, like other people have mentioned, when they have spoken out, they've been fired. I recently saw, actually, I think yesterday or today, where a gentleman has stated that he volunteered as cancer support to men and either was fired or let go when he was providing cancer support. Years ago, we had immensely very good support groups in Ketchikan for mental health and people that have depression. In 2006, I deliberately OD on my medication. I was on Matlakatla. There was no support groups there. And I was sent over on the Triton. I was in over at the hospital, and the people had support groups at SAIL. They were individual people. I met the people at SAIL at the hospital. They were amazing support. The hospital was amazing support. More than once, we've had, and still do right currently, some amazing providers in orthopedics, Dr. Dan. I've had 2 arm surgeries here, which is amazing because I did not have to travel. You guys have amazing case managers here that help me in seeking out resources. Shelley is one of them, but there's a few there that they help me in finding referrals and resources. Dr. Charles Jose, amazing. So ortho is amazing. Lance, amazing. So we do have some great providers, but if we burn them out, we're gonna lose them. Dr. Chin, amazing. The other psychiatry, amazing. So that being said, though, right now, there are no support groups here, guys, for mental health. Gateway is gone. I was involved with Gateway since I was 16 years old. I grew up here. I was a foster kid here. Many people know Gigi Pilcher. She's my foster mom and been in my life since I was 16. Bet Jakovic. That woman was my social worker. She's been and was from then till now. As a social worker, she was not just my social worker, she was my friend. We have no fetal alcohol, FASD, fetal alcohol syndrome. Years ago, 2015, 2016, Keith, who ran SAIL, we tried to develop a fetal alcohol syndrome community here in Ketchikan that would serve all of Southeast. Dr. Rosenfeld was going to be the doctor on board. We had someone from public health and community connections. We had people with KRC. We all sat down and we tried to make Ketchikan the hub. Public or Peace Health was not on board. KRC did not want to be the main provider on board. So that being said, there's no fetal alcohol community, no groups. By the way, again, I'm a birth parent. I grew up in trauma, did not know I was pregnant. You all need to get educated. There's teachers right now that have no education. They can say they understand. They do not. So I have a successful married, and she has 2 children, awesome and amazing. However, right now I've had to pull this little boy here out of school because, one vice principal and he got another para, took this little baby down. 2 200-pound men took this child down. The year before that, a teacher over at Hotline pulled this baby out by his wrist. It's not okay. Y'all get educated. So there's now, we're seeing 3 and 4 generation fetal alcohol and children. If these people, if they do drugs and they're pregnant, chances are they were exposed to fetal alcohol, it's permanent damage. When Gateway pulled out, you all do not have psychiatry here at all. That being said, my son, Jonathan Patterson, around March, he was at your all ER 2 times. He had already been an inpatient in the last year and a half 3 times. He had a long history of not just alcoholism, okay? That being said, he was being seen by Dr. Chin. Now, when we went there, me and his girlfriend massively emphasized he needed inpatient. We told them he was on and off his medication, psychosis, hallucinating, probably bipolar. Your staff wouldn't listen to me, and I was even threatened by management. If we didn't stop, be quiet, they were going to call the cops on me. I requested I needed a psych hold. They said I couldn't. However, 15 years before, my dad was a Vietnam vet. My sister called me and my dad had a double-barrel shotgun to his head. I was able to get one, and y'all saved his life. Why I was unable to get a psych hold on my son, beyond me. 2 times this occurred. Second time, my son was found unconscious on Tongass Highway. Again, y'all did not let me get a psych hold. Police said, no, go to court. I was denied again. There was 2 welfare checks by KPD, one at 1:20 a.m. on 117 Emont Street, apartment 8. My son didn't answer the door. Mind you, the police, at least 8 times this year, they had interactions with my son. He's forever 30 now. So it was documented he had a history of suicidal, wanting to harm himself. Around 2 a.m., the other person he was with called 14 times for dispatch. The person's home, they called the manager, the cops went in, talked to my son. My son, by the way, had been putting out messages on Facebook. They talked to my son less than 6 minutes. My son said, no, I'm not going to do that to my son. He had been alienated from seeing his child. His child's birthday was on the 4th of July. We didn't know where he was. None of us did. The person that knew where he was didn't tell any of us, but the cops knew my name. His son's birthday was on the 4th of July. He gave up. He took his psych meds that he had been on and off of, drank 2 pints of alcohol. The person also did not lock up the gun, so I'll be petitioning that anyone that has firearms, and if anyone has anyone in their home that has mental illness, they're going to be charged. You all, though, tried to get me arrested. So then after he did all that, he put 1 bullet to his head and he's gone now. But you all sat there, you Peace Health, you don't have nothing for psychiatric. Gateway's gone, people. Not only that, we told you guys, Pipeline is selling 4.4 liter tanks. Aero tanks, huffing tanks, and they're attaching a mask to them. Those people, by the way, told me condolences, and they're selling kratom that none of y'all seem to be telling the community about when y'all talk about addictions, which causes psychosis, hallucinations, and kratom is made similar and a derivative, and the effects similar to fentanyl. It's addictive. Y'all not talking about any of that. You simply talk about fentanyl and pills. Why is there not more education? Why aren't you guys, going when they talk about drugs to these children? I don't see any of you guys attending any of these things. So let me tell you something. And you public. Because it appears.
And
Yeah,
I'm gonna need you to wrap up. We have
I'm going
there are
to.
People in the.
I'm going to.
Thank you.
But people don't seem to know what they are. Have you guys seen these? These are Earl tanks. Do you know what they are? Exactly. Why don't you guys know what these are? Because you know what? I didn't know what these are. I didn't know what these are. 18-year-olds, that pipeline across from the mall. This is what they're doing. Kratom, tiny little bottles, and these kids, they think they're just energy drinks. But guess what? Once they do one container, they want to do more and more. Kids in high school and things, they don't know what these are. But guess what? My kid had 5 of these in his house. And you guys denied me a psych hold? The court too. Yeah? I want you all to see what these are. Yeah? And let me tell you something, all of you. I want every single one of you. Take a look. I want every single one of you to take a hard look. Because you know what? My boy was certified in welding. He was certified in scuba. He was a cook. None of you would get off this island if it wouldn't have been for my kid. And guess what? He smiled at everybody. Everybody said, we can't believe this occurred, because you know what? He was quiet. He was reserved. He smiled. He was a 6'3", very amazing, polite, and Yupak. But you know what? We're losing people. How many a month now, guys? You guys are here, okay? Not to make money. You're here. If you're in this community, these should be the people that you're treating. This is the community, and these are the people that you should be serving. And I've seen right out there in your little nurse's station where a doctor and these nurses are just laughing and joking. No, if you're not busy, go in there and talk to them, because you can make the difference for them to care about themselves and hope. That's what you all are doing here. And if you're not here doing that, talking to people, making them feel they have worth and value, you don't belong here. None of you.
Thank you.
Thank you.
Is there anybody else that wishes to address the hack? We have 40 minutes left in our meeting, and we do have business items that the committee does need to get through.
Tower, 48-year resident of Ketchikan. When I came to Ketchikan, I got off the plane in 1977. John Hayes said, take your teeth to Terry Thompson and let your birth and go to Peace Health. Yeah. At that time, we had a lot of clinics, but doctors who were not employed by the hospital. They had hospital privileges. Those very doctors, and many of them were internists, those doctors rotated at the ER. We didn't have ER doctors, but we didn't medevac people out here all the time either. As Anthony used to say, doctors here used to collaborate. We had a lot of people who lived here, and they brought, if a young doctor came in, the doctors got together. If somebody didn't know what a patient had, they got together and talked to each other, and somebody would have seen it. We don't have that anymore. I've had conversations with some surgeons and doctors who have left here. Spouses of doctors who have left here. Many of them said, we expected this to be our forever home. But the treatment by Peace Health of their employees and their doctors. I had one surgeon tell me, I own my own practice. I've worked for major hospitals. I've never been sued. I've never had a patient angry with me. My husband loves it here. But Peace Health, if I suggest something, they say to me, you're here to make us money, shut up and go to work, we don't want to hear from you, in essence. But I've heard this like from 4 or 5 different people. That Peace Health does not treat their doctors well, they don't respect them. And what has happened to all the doctors who lived among us, or nurses? These were our people. Those are the people we want to keep, because they will stay here. They're usually well-educated, productive people in our community. Those are the kind of people we want. And yet, I've heard from doctors and other people, we have lost anywhere from 45 to 67 doctors, not that long ago. I mean, within so many years. And they never say it's the money. They never say it's the patients. They like the people of Ketchikan. They like the facility. And by the way, that facility, all of us who live in the city, your house is surety for that bond, $42 million for that ER, of that OR. We are responsible for that. And I think Peace Health is a Catholic organization. Do unto others. How about they send some administrator down here who actually cares about the people of Ketchikan and wants to retain the doctors and the talent we have?
Thank you.
Thank you.
Yes. I'll keep this very brief, and very specific to Peace Health.
Can you state your name, please?
I'm sorry, Kathy Fitzgerald, I live in the city. I apologize if I get emotional. At the end of April, my beautiful 31-year-old daughter was seen in the ER at Peace Health because she was having a hard time breathing. She'd broken her rib a week before, and they suspected that she had pneumonia, did an x-ray and did indeed find that she had pneumonia. The ER doctor administered 2 different forms of antibiotics and had her admitted into the hospital. Over the next 30 hours, I stayed by my daughter's side in the hospital. And during that time, I asked a minimum of 3 times 2 nurses, respiratory therapist, charge nurse, why my daughter hadn't gotten her next dose of antibiotics. And every time the answer was, she's fine, everything's fine, it's good. I asked to see the nighttime physician. He sent me a charge nurse and a respiratory therapist. And in the 2 nights she was there, he never laid eyes on my daughter. The second time, after 29 hours, when the day hospitalist came in to look on my daughter, I said to him, she has not received any antibiotics since she left the ER. They are critical for a patient who's been administered or has been admitted with pneumonia. They are standard care. He looked at me and said, well, I'm sure she's gotten them, but I'll go check the record. He came back a little bit later and said, my bad, you're right. I didn't put yours in right. I just put into, to continue the ER orders. ER orders drop off as soon as a patient is admitted into the hospital. They don't continue because they're discharged from the ER. There were no orders for my daughter for antibiotics. 31 hours after her original antibiotics, she got the second dose and rapidly continued to decline. My daughter died in Bellingham a week later due to complications from pneumonia. She was a vibrant, beautiful 31-year-old girl who had fought many, many health challenges and was doing well. She was months away from getting her master's degree in social work and was excited to open her own counseling clinic here in Ketchikan to help individuals who are working on substance abuse. My daughter didn't have to die. Why didn't 3 different nurses, a charge nurse, a respiratory therapist, 2 doctors, and a pharmacist, why didn't any of them, they're all medically trained, why didn't any of them listen to me? Why didn't any of them check? Were they afraid? Were the nurses afraid to ask the doctors? I don't know. But there's something that's not working amongst the staff at Peace Health. The communication is not there. And because of it, people are dying, and they will continue to die unless there's a change and there's some accountability from Peace Health. Thank you.
Thank you.
I'm gonna speak again. You guys are aware, right? I don't know if any of you are aware. On social media, there was a 12-year-old girl down in Bellingham. I don't know if any of you are aware. There was a 12-year-old girl down there in Bellingham, Washington. She had a history of mental health illness or depression. She was supposed to be on a cycle. Evidently, she had been there before. That being said, she was in there on a cycle that to be watched. Somehow, some way, she wasn't watched, and she committed suicide in Peace Health, Bellevue, Washington.
Thank you. All right, I'm going to close the public comment portion of the meeting. You all are absolutely welcome to attend the meeting in 30 minutes and address the Community Health Board with any further comments or the ones that you made tonight. We will move on to item 5, which is approval of the July 31st, 2025 meeting minutes of the Healthcare Advisory Committee. Is there a motion? Motion. Is there a second?
Second.
There, and Amanda, thank you.
I'm sorry, I just got here and I know you closed this, but I just got off work. I would like to share my story if that is possible.
Okay, Mel, go ahead.
Thank you. Hi, everybody. My name is Melissa Telez and I am a former employee of Peace Health as of October 8th. I'd like to share my story. April 28th, I walked into Peace Health ER and I had had preparation from diverticulitis. I seen the ER doctor, went back, I was examined and then taken in for a CT, which they resulted with a perforation of my sigmoid colon. With that being said, I was having extensive pain. Within 4 hours, I was given 1 shot of Dilaudid, 2 shots of fentanyl, 1 roxicodone, and 1 oxycodone in 4 hours. I was being discharged to go home, even though I was still in pain. I had to advocate for myself to stay the night. The doctor comes back in. I requested from the nurse, as she was bringing medications in a bottle for me to take home, 6 oxycodones. And then another friend nurse was there with me in the room, and she advocated for me first because I was heavily under pain medication. So with that being said, I asked for the doctor to come back in, and the doctor was wearing a mask and was talking to me and stated, "What do you want? What do you want me to do for you? I have already given you Dilaudid and fentanyl. I cannot give you any more than what I've given you." Although I was an employee and I stated that I was an employee, I was so disrespected, so mistreated. With that being said, as I was spoken to in that manner, I looked at her and I said, "I did not ask you for Dilaudid and I did not ask you for fentanyl. I asked you to help me. She leaves the room. I'll see what I can do. And so the nurse comes back in. Nurse Alex. She comes back in and she says, the hospitalist is gonna come in and see you. And, I said, before that, I said, could you ask the doctor to come back in? I would like to speak to the doctor. The doctor comes back in and what can I do for you? What do you want? And, I said, look, I think we got off on the wrong, but I was just asking, some questions, just wanted to see if you could help me. And she goes, well, you're getting what you want. Storms off and walks out the door. The hospitals will be in shortly. I had to literally advocate for my life. So I ended up staying the night. 24 hours later, I was full-blown septic. I laid for 72 hours before I even went into the OR. In between that time frame, I was seen by an ER doctor, 2 hospitalists, and the surgeon. But the surgeon I didn't see until I think that Tuesday, because it started on April 28th. It went that Sunday, Monday, Tuesday, Wednesday, I finally went into the OR. Because of the mistreatment that I received, and because of the negligence that happened, I have a 12-inch vertical wound, open wound. My sigmoid colon was removed, and then I had a colostomy bag. And with that being said, I knew I was going to have a colostomy bag because with standard of care, with having your sigmoid perforated, after 3 episodes of diverticulitis with perforations, I should have had surgery at the instant that I walked through that door, gone to the OR. But no, I laid septic for 3 days. So it had me staying in the hospital from April 28th to May 22nd. I had a wound back for 2 months. In between all of that, because I was so septic, it ended up, May 1st was my first surgery. May 5th was my second surgery. May 5th, I sat up on that bed and I looked out that room 219 picture window and I said, God, forgive me of my sins. Cleanse me and wash me clean that I might know you this day, that I might be with you. I told somebody I'm dying. I knew it, I felt it. So I was ready to go, but he wasn't ready to take me. But with that being said, 2 doctors later came back in and said, we're gonna have to take you back into surgery. So I had 2 major surgeries within a matter of days. May 6th was that second surgery with a 9-meter washout. So I suffered from the first surgery with a 12-inch midline scar, and then then the second surgery was the washout with 9-meter solution. It's all in my records. And then I had an abscess form right on my belly in this circumference, square. And they couldn't drain it. So they had to remove the wound vac, which was sincerely painful. And then they had to debride it. I went home finally and I was on home health care. Just the traumatic experience of everything that I experienced. I just want to say to the board members and to the city of Ketchikan, who's going to be responsible? This community. I'm part of that community and I worked for Peace Health and I appreciated my job. I love my job. I love what I did because of the monotony of how things are there and the care that I received. I decided to move on. Who's going to take care of us? Who's going to advocate? Who advocated for me? Who's advocating for the community? It's hard for me to stand up here and share my story because of the trauma, the PTSD, the anxiety that I've had to encounter, the therapy visits I've had to encounter, the thoughts that I've had, I felt like no one was listening to me. And I'm asking you all today, hear your community, hear your people, because this community needs a good hospital. Trust needs to be rebuilt. If you cannot do that, you are not going to have a hospital. The integrity of care is so important. I fight for what I believe in, and I want to fight for this cause right now because it was so detrimental to me. You have no idea how hard it is for me to stand here and tell you my story. June 24th, I had to have my reversal done. And thank God it was a lot more better. It was better than the prior two surgeries, which was inexplicable. I can't even explain the agony that I went through a whole month. Not being, if I would have been med-backed out, I would have died on the med-back. How do you let somebody lay and set for 3 days, septic, between 4 doctors? Where's the answers for that? And then you wonder why people are asking questions about our hospital. You wonder why the trust isn't there. Culture is bad. The narrative is bad. I love my job and I love Dr. Horton. I love Sarah. They have been such great community for me at work. Great people. Dr. Horton will walk by and say, good morning. He stops at your desk. Sarah will do the same thing. And I think that's what this community needs. And I did file a grievance. I was not heard. In my grievance, it was more or less, you made your decisions for yourself. What kind of response is that? Who's gonna hold? They're holding me responsible for actions that were not my own. What is the oath of a doctor? Do no harm. So I'm asking you, oh wow, I'm asking you for these people. I'm asking you for this community. Please hear us. Please hear their voices. The same exact care that you expect, do you not want to give that to somebody else? Your title does not define you. What defines your title is how you serve that title with dignity, honor, and respect, and loyalty, and kindness, and love. There is such, there's no humility. There's no servitude. Why do we go into the profession that we choose to? It's to serve one another, to give back what others lack, to share in kindness. Why? So many whys. But I think that you as board members, and here is the town hall, it's time to take a stand. It's time to hear everyone's voice and give hope. We need hope. And without that, you're not going to have a hospital until you rebuild the narrative and until you rebuild the culture. With power comes influence, and with influence comes humility. There is such a lack of humility, and there's such a huge entitlement. So I'm asking you, hear the voices of your community, hear my voice. Because if you don't hear people, you're doing a disservice to them today. Thank you.
Thank you.
Okay, we have a movie.
Yes, okay, so currently we have a motion on the table for the approval of the July 31st, 2025 minutes. If there's no discussion, I'd like to call for a vote. All in favor, please say aye.
Do you guys comment on these comments, public comments?
We
No?
do not.
Oh,
The Peace Health does have a 6 o'clock town hall meeting.
And again, because that meeting has been scheduled, many of you are here for that. There are others who are coming for that. And many of the individuals here need to attend that meeting. I would like to defer all of the old business items that are on today's agenda and move directly to new business items, including the 2025 report card for Peace Health There's no objections from the committee.
The next meeting is January 26th. We'll do really old business.
Correct.
Right, we have our annual report, right? You know, living quiet. These are the core services that were provided in fiscal year 25. It shows all the names listed on the left, the availability and how many visits for tests or meals or deliveries to the right. Our visiting physician services are on this report card. These are all of the visiting services that we were able to offer during fiscal year 2025.
Down here, we can't really hear that.
I have a thyroid issue and I cannot project my
Okay.
voice.
Is there a paper copy of this that we can
It should be on the recording, Judy, tomorrow.
have? Okay.
Otherwise, I'll request it and have it sure.
Yeah, we will get copies.
This slide talks about our provider recruitment and how long the positions have been open, the national average time to fill. Fine. Billing and collections. These are our financial assistance plan and the total dollars adjusted, total number sent to collections, and percentage of bills sent. Any questions on that?
Do you recall, sorry, Sarah, do you recall how the sent to collections compares to the prior year?
I'd have to look.
Okay.
Alright. This one talks about the community benefit and charity care that Peace Health provides. So there was about a little over 100,000 in community benefits that we partnered with community entities here. And then the bottom number is our total of charity care provided to patients in Alaska. All right. So here is recommend the hospital in 3/4 of fiscal year 25, we were in the green, and in the Q4, we dropped into the red there. And then rate the hospital, we have 3 areas of green again and 1 area of red. And we have areas to improve on in-nurse communication. We've got 3 red boxes out of the slide. Now physician communication. For the most part, they had 3 really strong quarters. It dipped down a little bit in Q4 and then back up in our Q1 of fiscal year 26.
And these are based on patient surveys. Okay.
Right, so we had 0 falls with serious harm in fiscal year 25 and 0 early elective deliveries. That's any deliveries before 39 weeks. Our class 3, which is our central line associated with stream infection, we had 0 of those. And our hospital acquired pressure injuries, we had 0 of those in 2025. We did have 1 catheter associated urinary tract infection in Q1. And then 0 in the following quarters. So doing really good for our clinical quality. Our nurses do excellent work. A little bit about financials. Our total operating revenue was 101 million and our operating expenses and capital were 106. So we had a total loss of over 5 million for fiscal year 25. which, the charity care that we provided really can show here, so. Next. Good. All right, and that is it for the report card.
Are there any questions from the HAC committee on the report card? Nobody could hear it.
No, today, but there may be done. If I could
Yep.
read it. and
So
see it.
this meeting will be posted tomorrow to the city's website, and we will also get the presentation from Peace Health, and we can also post that to the city's website.
You couldn't hear, it, see it for question, public forum. I find that unacceptable.
Okay. We're moving on to new business item number 7B, which is the 5-year lease review. There's not too much to add here. This is a conversation that will need to occur between Peace Health and the city in the next year. As we approach the 5-year anniversary of the new lease agreement that will come into effect in October of 2026. I thank everybody that was here tonight for their comments, which may factor into those ongoing discussions between the city and Peace Health. This 5-year review process is a condition of the lease agreement in which the parties come together and determine if there are any aspects of the lease that they would like to modify or change. So this will be an ongoing dialogue that the two parties will have over the next year. All right, moving on to new business item number 7C, which is emergency department patient rooms based on population. This is something that had been asked of Peace Health in relation to the emergency department renovation and understanding what an appropriate number of patient rooms is. So Scott, I think that was, or was it Sarah? One of the two.
Was it based on state?
Yep.
See that.
Maybe they can hear you a little bit better.
So our, this is in reference to the design for the new, phase 3 of the remodel plan, and the certificate of need formula. So essentially, with 8,386 ED visits in fiscal year 25, that, certificate of need formula specifies one exam room per 1,500 annual visits, with some allowance for specialty procedures.
Was there any more questions?
No, I think we just wanted to understand what the appropriate size needed to be based on population. Yeah.
And I'll go through the certificate of need process through the state and then we'll look at all of our numbers to
Based on what we currently have, our volume does not, offer room for expanding based on the current rooms that are, reconfiguration and specialty rooms are a possibility. So specialty rooms, behavioral health, holds, infection control, for respiratory illness.
Okay. Thank you, Kate. Any questions there from the hack? We'll move on to item 7D, which is the long-term care survey by the Department of Health.
So we had CMS and Department of Health come and visit. We, self-reported allegations that were made for, abuse and resident rights. They came in and we received citations. And while they were there, they said that several of them had already been fixed before they got there, during the time that we self-reported and them arriving.
And what were those?
So we provided a plan of correction to the CMS and to the state, but because of the furlough right now, we have not heard back on them. So we are waiting for them to reopen. So, and more details will be shared at the next meeting.
To be clear, you're still out of compliance.
Will we get a copy of that?
It's on the table.
No, I know that the complaint's on the table, but I'm wondering the follow-up. We get a copy of it.
Sarah, can you give just quickly a date that, that CMS came to, or dates range that they came to do the survey?
So,
September 2nd through the 9th.
probably,
Okay.
yeah.
Any questions from the committee on the survey?
Once you do receive feedback, what corrective actions, or what is the time frame for corrective action, and what would be done? You know, the timeframe was the 24th, and we had completed them all. We were just waiting for them to come and approve. October 24th. So the date has already passed.
Okay, moving on to item 8A, which is future agenda items. We have listed just the nomination of the chair and vice chair positions, which is something we need to do on an annual basis, which rotates between the city and Peace Health. But apart from that, are there other items that the Healthcare Advisory Committee would like to offer now, which is not to say that they can't be offered later before our next meeting in January?
And if we can, you can just forward them to.
Absolutely. Yep. Yep. Seeing and hearing none, we'll close out future agenda items. And now we'll go on to committee comments before adjourning. Amanda, we'll start with you.
I'd like to thank everyone who came to speak. It's really concerning to hear what we heard today. But it's good to know how everyone is feeling, and you know, I'm not on social media, so I don't hear a lot of the comments. But I value our nurses and doctors in this community, and I want you all to have a good working environment. And I take this committee position very seriously. And I want to make sure that we have a good relationship with the city and Peace Health, and that we can make this the best partnership that we can. So, and that you are represented. So, thank you for coming to speak to us.
Judy.
I'd like to thank everybody for coming, and the one thing that I seem to have heard repeatedly tonight is communication and accountability. And we seem to have a problem with both of those. And I think we really need to address that. We all love our hospital. We want to keep our hospital, but we have to admit that there's some issues. So let's throw it on the table and deal with it and come up with some ways to solve this problem. I don't want to see Peace Health go away. I've spent the last weeks with an open door office, listening to everybody coming in. And a lot of them talked RFP, and I'm like, what does that mean? Do you know what that means? I mean, how long that's gonna take? What's all involved? I think that what we need to do is have better communication and transparency. I mean, this report, somebody sent it to me. I would have expected to get that. I'm on the HAP committee. I would have expected somebody to say, hey, Judy, we got this issue going on. We need to deal with it. This is how we're going to deal with it. For two reasons. One, because I'm on the committee, but two, people are going to call me because I'm on the committee. And I have to say, well, I don't know. They never told me. Everybody knows it's going on. Let's just own it. and start communicating a lot better because it is embarrassing. I know a lot of people who work there. They're proud to work there. They do great jobs there. They work really hard. I rarely hear about the care, to be honest, but I do hear a lot about how our employees are treated there. And there are people. They're not, yes, we get folks from out of town, but these are our neighbors. These are our friends. These are people I have wine with. I mean, we need to do a better job. And it starts with us. And so I really hope we get down and do it. And maybe waiting till January is not going to do it. Maybe we got to meet sooner or find some different way to communicate. But we certainly have to do a better job. And I think we can do that. We just need to bring in the right people to help us do it. Oh my God, sorry.
Thanks, Judy. Dr. Horton.
I don't think I have too much to add right now. It's more comments after the town hall, but I appreciate everyone making their comments and sharing with us tonight. Some tough things to get. Yeah, I would echo, their committee members have said, thank you all for showing up, for speaking out. I am proud of the work we do. I've worked with Peace Health for 30 years. So it's not easy to hear some of those things. But, as a committee, I do think, we all need to spend a little bit of time interpreting what it is and what our goals are as a committee. I do think we need to, because you can read the lease, we can all read the lease, we can all interpret it differently. And I wonder whether or not we're all on the same page about what it is the hack is responsible for and what it is we're supposed to be doing. Because I'm a little worried that maybe I don't understand what it is our ultimate goals are as a committee. But I have always been interested in improving the departments that I work with and the hospital as a whole. So it is tough to hear some of these comments. And I look forward to having some of those discussions to try to find how we can, as a committee, help some of those improvements.
Thanks, Sarah.
Yeah, thank you, everybody, for being here tonight and sharing your stories. Thank you.
I too would like to thank everybody again for coming and sharing some very personal stories. It takes a lot of courage for you to get here and share that type of information. And that is one of the charges of the hack, is to hear those types of comments. If you are unaware, the hack meets quarterly. So this is not your only opportunity. It's not a once a year opportunity. We meet quarterly, and we certainly encourage you to come to those meetings on a regular basis. However, if you have read the lease, the hack does have limitations in terms of what it is responsible for monitoring and how it can respond to certain things. Details such as patient care and resolving those sensitive issues, human resources issues, these fall outside of the lease and what the Healthcare Advisory Committee is responsible for. Nevertheless, we're always happy to hear those things and to try to respond to them and see if they do apply to the charge of the hack and the lease agreement. I'm really looking forward to the next year and how the hack and both the city and Peace Health can continue to evaluate the lease agreement and how we partner and communicate as entities. That's one of, I think, the really fantastic things about the lease agreement that we have put together, which unlike anything that existed prior, it allows for that communication. It's a fluid and plastic type of agreement. It's not set in stone. That 5-year review is the exact moment to take a deep dive and make sure both parties are still true to the lease agreement. So again, I encourage all of you to continue the dialogue with the city, with Peace Health, with the hack, with the Community Health Board, as we continue to have those discussions and see what the next 5 years may bring. So thank you again for attending, and again, encourage you to head next door and continue dialogue with the community health board. Thank you.
Thank you.
You can stuff that. Read it.
Let's.